Male victims of intimate partner violence are often invisible in both public discourse and clinical settings. In this episode, we explore the psychological impact of that invisibility, the cultural and structural barriers to help seeking, and how service providers and researchers can do better. My guest, Dr. Alexandra Lysova, is one of the world's leading experts on this topic. Her research challenges dominant narratives, highlights the complexities of male victimization, and calls for more inclusive approaches to support, language, and intervention. I'm your host, Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia. Welcome to Psychotherapy and Applied Psychology, where I dive deep with leading researchers to uncover practical insights, pull back the curtain, and hopefully have a little bit of fun along the way. And please feel free to leave a comment below. And if you enjoy this conversation, it'd be much appreciated if you hit the like button and subscribe to the channel. So without further ado, here's my conversation with Dr. Alexandra Lysova. How do authorities react to men when men bring up
Yeah, these issues, yeah.
yeah.
So at this point, I say it's very unfortunate. I, I still don't see much change in the way that we starting prioritize the help of boys and men. Maybe very recently, in fact, probably due to some political changes, and people have noticed that actually boys and men experience it difficulty and they're actually struggling, and we know they struggle in the education system and the health system, like they're struggling all of a sudden. So I'm so glad we finally seen it. um, we need to develop better ways and preparation of how to talk to men. It's extremely difficult to invite them to the research, to the study. They don't trust researchers, and for a good reason. I know a couple of examples. They don't want to talk about the weaknesses. um, and it's for the service providers. What I think is important is just to even have this idea in mind that it may be a victim before you're not a perpetrator, not to have these biases just based on gender that, oh, it's a man by definition is a perpetrator. So I've seen in the literature examples of how bias can affect our vision of men. For example, one example of famous researchers conducting interviews with men who killed their partners and they in prison. And when they said that the relationships were extremely toxic, they're extremely violent, there was a lot of bidirectionality, they simply dismissed it. They never even took it into consideration. Oh, they just blame the victim. Oh, they just do not take responsibility. It's a lot of moralizing rather than trying to understand what if the relationships are extremely toxic. It doesn't mean that we kind of exonerate them. No, they killed their partners and they should be in prison, but understanding how we could help earlier, just simply understanding that that's probably was the case. We shouldn't dismiss the experiences, but listen to this and learn how we could do better next time. So that's my approach, more humane approach, more reasonable and more humane to men. So yes, researchers should do. We need to develop certain strategies. Men don't like to be called victims. They don't like certain words. If people ask this kind of directly to them, this question using the word, they say, "No, I'm not a victim. I'm not here because I'm a victim." So no, they will not go to build this rapport with a service provider. But if we ask them, what terms do you prefer? They still want to keep some agency. So they want to say men who experience abuse, right? Like something like that. So certain other types, certain other questions, but acknowledging that they may experience that and asking questions about it in a kind of finding a way to really ask that. So it's not kind of surprise for these service providers, but that's a reality that these men may live.
So is it the case that because of, I mean, as you're talking about sort of the internalized stigma, the way people respond and react, that men are even less likely to report abuse than women are?
Oh, much less likely. Yeah, much less likely. So on this Canadian study, um, they do that because the questions are behavioral, right? So it doesn't ask them um, to see themselves as victims. So they simply answer to the behavioral items. But when it comes to the question of recognizing that you're a victim and going to look for help, this is where it gets very difficult. Men are much less likely, and Statistics Canada shows it. If you look at their charts, you can see that they're always women going for help, talking to a family friend, going to family friend or coworker, going to a doctor, talking to. But with men, it's just unlikely. They wouldn't go to, they talk, I think the only similarity is that they talk to a coworker whom they trust, but and maybe to some family members, but it's not, they don't look for formal help. That's likely. And we did recently a study on coping strategies for male victims, and we see that which they choose most likely what it's called passive coping strategies, not actively looking for help and doing something, but passively saying, oh, I'm at work, so trying to avoid family communication, staying in the family, going away, doing something for work, or substance use. So that's another way to escape reality. So we see that, and that's dangerous. So if we develop better understanding among service providers, that men can be victims, so there will be more willingness to, to help them and to be more welcoming to men. Many shelters are still open only for female victims of abuse. Many non-governmental agencies still open only for female victims of abuse. If we do it more gender inclusive, right?
Mhm.
If we make it for any victim of abuse, you maybe anybody, and if you experience violence, come and we'll help you. So yeah, we need still many steps in that direction.
You said earlier that men don't trust researchers, and that there were you had some examples of like good reasons why they shouldn't. Could you give us one of those examples?
Yeah. So in that study, men were called to participate and report on their experiences with their children. So it was on custody issues and parental alienation issues. And men, honestly, during the study and talked to the researcher about the experiences, they complained about the criminal justice system. They complained a lot about unfairness, the way they treated in the criminal justice system. And then in the report, the one that was published by that researcher, it was calling them um, some kind of labels like all these weak people, something like this. So it was, they were called terrible words, and the experiences were very much not just twisted; they were interpreted in a way as in a disrespectful way. So it's yeah, I actually call the question for the ethical review to look into this, because this is something that damages the trust with our researchers. Researchers can definitely describe experiences of male victims, and they may see that they may describe it in a neutral way, right, without disparaging them. um, yeah, so
Right. So when we look at intimate partner abuse across different nations and cultures and that sort of thing, do we see big differences?
great question. We don't see great big differences in our. Right now, we did the study in 7 English-speaking countries, but again, it's mostly England, Scotland, Australia, New Zealand, Canada, United States. All these countries, we don't see many differences. There are a lot of similarity, especially in relation to male victims of domestic violence. Um, we When we look at some studies that did comparative research in Europe, and there were studies that compared experiences between both men and women in 6 largest cities in Europe, in 6 different countries, they don't see many differences in the rates of violence. So again, we look at the rates of violence. It's harder to look specific risk types of abuse experienced by them, but again, not big differences if you take European countries. I'm glad to see right now there are some studies coming from some other countries, and I'm seeing, for example, studies from Africa, especially in relation to male victims. They showing some interesting forms of abuse, attack with machete, or something very specific for the cultural context. We still don't see very good population-based studies. It mostly come from smaller samples. Uh, Again, I know the very interesting country right now I'm looking at is Japan. A lot of secrecy. Domestic violence is very much hidden, and people do not talk about this much. But I know there are some studies that government of Japan is doing, so we're looking into those rates of violence there. So again, what I would say in the we do have, I'm a part of the big international dating violence study where there were 32 countries. This is where we see big difference in the rates of violence, starting with as low as about 10, 15 in Scandinavian countries, going up to about 70 in Iran, Afghanistan, in some other countries. So we do see a huge range. in relation to um, victimization of men and women. And we do see similar differences in the very big range in World Health Organization studies, but it's only for violence against women. We
Mhm.
also they publish studies regularly when they also have about 30 countries. And when they look at violence against women, it's mostly in relationship and family context. We see a big range starting from, again, in about 10% in some European countries and going to 50, 60, and 70% in some countries like Rwanda. It's a lot of violence there. So so we do see in the world there's a big range in prevalence rates of violence against men, both violence against men and women, types of victimizations, and how the societies treat domestic violence in some countries is just not it's not a big deal. It's not considered to be a serious issue. Like now in Russia, I wouldn't say we treated it more seriously several years before. Now it's not it's not something people really discuss that openly.
Huh.
So it's changing too, depending on the political situation. It's changing.
Okay. So across when you're just looking across like these the handful of English speaking nations, you don't see tremendous variability, but when you're looking globally, you do start to see a lot more variability.
Yeah,
And
yeah.
these are mostly based on cultural norms, is how you make sense of it.
Yeah, this is how we make sense of it. Yeah, we there were some examples that didn't make sense to me. For example, in Russia, the homicide rate is much higher than in some European countries, in Canada, for example, or even the United States, and of course Europe, where homicide rate is very very low. It's about one, between 1 and 2, and in Canada it's 2 per 100,000. But in Russia, it used to be 20, 35. That was very high, but domestic violence rate, according to the service, was nearly similar. It was about 25%, like in the rest of the world. So to me, it was surprisingly how, because I would expect domestic violence rate would be correlating with homicide rate. So higher homicide rate, higher domestic violence rate. While it looks like it's the case in many countries, it may not be the case in some countries. So overall trend, yes, more violent societies, weaker rule of law, more gender inequality index is higher. Then yes, we see more violence in intimate relationships overall, but it's not always a perfect correlation in some
Mhm.
countries.
Okay. So we've talked about this somewhat, but are there other things, or what do you think about in terms of like what differentiates relationships where intimate partner violence against men happens versus those where it doesn't happen?
Um, okay, good question. Interesting question. How to differentiate those relationship? Um, Interesting that there was a study in 2006 by Archer in the United Kingdom who looked at the changes in patterns of violence in different societies, and he found that in countries where gender equality is higher, so women have more power in the society, there is more mutuality and more violence against men. So I would say sometimes I think that strong, independent women, um, not much afraid of their partners. They know the system is on their side. So, and it's not, again, I'm not saying that this is the only factor that may push women to do that, but um, women feel protected in the society, and also there are many different factors like personality traits, intercommunication skills, stress in the family, financial, children related, any other stress. They all play a role, right? So again, it's hard to say, it's a general question, but violence happens where there is a certain stress, there is a certain history of violence in prior relationship or in childhood,
Mhm.
experience of violence as children. It's a very strong, the strongest predictor of any violence is experiencing violence as a child. So when we know those who experienced violence as children, so they were disciplined physically by parents or they were actually physically abused by parents, they are more likely to become perpetrators or victims in the relationship. It looks like they learn the idea that violence is just normal part of life.
Mhm.
And violence, if you love people, you actually perpetrate violence against them. So it's almost like love equals violence. So this is a norm they acquire when their parents say, just because I love you, I hate you, right? Because I want the best for you. This is how I discipline you. So they learn this concept. So I see it happens. Violence against men happens in a relationship where partners just consider it as a norm,
Hmm.
or they just think it's they don't know about the other ways of dealing with violence in a relationship. This is the best way they have.
Hmm.
So yeah, it's unfortunate. Mhm.
Are the psychological impacts of intimate partner violence or abuse, are they, when you think about sort of the psychological impacts when men are victims versus when women are victims, are the impacts about the same?
A little bit different.
Hmm.
Overall the same, a little bit different. So um, they are similar in a way that men experience um, the nobody likes to be, you know nobody likes violence, right? So but men experience less fear in the relationship. This is Statistics Canada findings, and also we know it from focus groups. Men, it looks like they experience serious long-term consequences of abuse, so post-traumatic stress disorder, depression, suicidal thoughts, and that may be very similar to women, and maybe even in some ways more damaging for men. But this is something we need to look into. With inattention to the field of male victims of domestic violence, there was not much attention to look into the consequences of abuse for men. But we know, again, they are serious, they are long term consequences for their psychological health, for their well being.
So one of the questions, or I had a couple questions around, I know you're not a therapist, but sort of thinking about whether it's therapists or thinking about social workers, or I mean, hell, even law enforcement, like how might folks be able to, like, what might be like signs or indications that perhaps this person, this guy, is experiencing intimate partner abuse?
Hmm. Yeah, good question. So these are the clear signs of indication. Um, so yeah, I think it's important to um, I yeah. So I can just, based on the research that we've done, to think about it. So they will be silent for a long time. They will not be initiating. They will not be very actively talking about the experiences. Men are shy in this respect. They're very embarrassed, so they will be silenced. The idea is that not to take silence for the lack of violence or just because they're not victims, not to take it that way. So one man told me it took him 12 years to finally get the idea that the relationship he was in were extremely toxic and very dangerous. And right now, looking back, he says, I can't believe it. I spent 12 years of my life living in this hell rather than looking for help early and getting out of it. So I think men would be, it's important to be proactive with men, to be proactive. I mean, they maybe, of course, they have some injuries on them from violence, and that's clear that they were victimized. But I think it's very important to find a way to talk to them. And what I know, some men reported that when the police officers treated them humanely was when the police officers themselves were victims of abuse. So they knew what it's like, and they would just take them to the side and say, you know what, I know what it's like. So talk to me, tell me what it is. I really trust you. I trust your record. So the point is, it's kind of, if it's a more humane relationship to the victims of abuse, something we do towards women right now, the way we treat women right now. So if we have the same, so there is a chance that men will reveal what happened to them. Many of them would stay silent because they think it will never help them. Many of the men really believe the criminal justice system works against them,
Mhm.
and doctors just don't get that as well. So it's important to, from the beginning, saying I'm aware that it's not just women, men also experience abuse in different forms.
Mhm.
So basically be proactive about it, showing that we are aware of this, it's not a surprise to us, and we're here to help. So whatever you want to help, we can help you with, please reveal it to us. And so just to be open and frank with them. Yeah.
And is that so? Based on what you said earlier, would it make sense when to ask direct questions more about behaviors
Mhm.
rather than using terms like abuse or violence, but
Yeah,
instead, does your partner ever slap
yeah.
you? Do they ever, whatever?
Yeah, that's right. That's a strategy without using words victimization, victim, survivor. They don't like this either. But yeah, most specific forms of behavior. Does it ever happen that she did something to you? Like, did she behave in this way? It's more about helping them understand. And they say, yeah, it was not violent, but yeah, she did it. Yeah, she tried to attack me with a knife, but because she didn't feel well. Like, they immediately try to explain that, but they will say about certain forms of behavior that happened. They will never call them violence, but this is what it is. This is
Mhm.
violence.
If there's a man who were listening to this who were uh, suffering from intimate partner violence, what would you suggest to them? What would you tell them?
It depends if they are currently in a relationship or they were priorly they were previously in violent relationships. So if they're previously, so it's good, it's behind them, but there is still maybe trauma experiences of that. I would say to these men, especially those who are currently in relationship, is that um, there is help available. Um, there are organizations, there are many men who experienced violence in the past, and they right now helping other men to deal with this, to find out better relationship, to develop other relationships. So and I find it extremely helpful. Those men who right now out of those violent relationships, they say my life has changed so much in so many ways. They feel much happier right now. They got jobs. So and they feel it after therapy they did. In British Columbia, in Ontario, so they actually won't go to Canadian Centre for Men and Families. There is a wonderful organization, CCMF, Canadian Centre for Men and Families. They have many resources online. You can contact them, and they have headquarters in Ontario, but they also have branches in British Columbia, in Alberta, in Quebec. So they can always refer you to the specialist, to the psychologist, to the focus groups. There are many, I know, initiatives right now when men help each other. They get in it together with the groups and talk to each other and help each other, and it helps tremendously. I've talked to again men who benefited so much, and they said, "Thank you so much. We have those resources now, not like back in the day when they couldn't find anything online." I know the outreach programs, non-governmental organizations are working more on violence against women in the United States. There are many more efforts to help men in the US as well, in the United Kingdom. Men's Project, there is a wonderful organization there. So yeah, there are resources. You're not alone. It's almost like what we said to female victims in the past. It's almost the same thing. You're not alone. And it shouldn't be like this. There is a way out of this relationship. There is a way to better life. No one deserves that.
So one of the questions I asked everyone that I talked to, and you sort of alluded to this at the beginning of our conversation, is have you gotten any pushback for your work?
Yes, of course, it was a pushback. Yeah, it's a hard topic to study. Again, to my surprise, I'm for so much for open inquiry and respectful disagreement. And I always believe that academia is the place where we do this type of research. This is exactly why we're here, to fill the gaps in our knowledge in order to help people better. But then, yeah, there is a backlash. And there were kind of situations at the conferences when somebody's yelling at you and telling you that you shouldn't even ask this question when I
Really,
present.
somebody's actually yelled at
Oh,
you.
yeah, it happens. Yes, it happens. When I presented at the conference in Australia, and it was on women's aggression, just because it's the other side of the issue. There is a male victimization, but there are women who perpetrate those violent acts. So we looked at women, at their rationale, why they're violent, how they're violent. It's another big, interesting topic, and how we can help these women. And as it turned out, we're not good at it as well. It's not that many resources. We have to help women who are aggressive and need help. So and yes, and the discussion was that why do you even ask this question, as if there are no more good questions to ask, why are we even here? So it was yeah, there are some heated debates on that, and you kind of have to protect, you have to defend yourself, defend your topic, provide statistics, and be there, right, just to resist and protect. and do not succumb to these attacks, it is harder to get grants. It's just harder to get grants. On one grant application I've got, it was exactly this kind of comment: why don't you take another topic? And it's about male victims of domestic violence. Yeah, so it's like, why do you even study that? So the question, the idea itself, why it's not important, while we have some other more important issues. So I find uh, not it's not good for academia to do that. Yes, and then one another example I can give you. So we were trying to publish a paper on with our research or focus groups on male victims, and one of the reviewers who rejected the paper said that, how do you trust men that they tell you the truth? So it's almost a suggested we should give a lie test, a lie scale to our respondents. And I was thinking at the time, I just tried to think about the situation with female victims of abuse and trying to imagine if they ever would be courageous to ask that question, saying, how do you trust your female victims of abuse that to tell you the truth? So it's a lot of double standards. But good news is that even with this pushback, it's important to go forward and doing our work, and we see the change. So the great thing is that we actually see the change in slowly in public attitudes, in academic community for sure. There is more acceptance of this issue. There are many more publications. The graduate students not that much deterred from going to study this issue, just because they don't think it will be a damage to their career in the future. So we finally doing better in the past several years. I see there is a change.
One of the things you said early on in this conversation that I thought was interesting is it seems like some of the existing theories about intimate partner violence, because that work was really geared towards women who are victims, that a lot of the theories sort of presumed this particular sort of gender dynamic, right? So it's sort of, and that studying male victims kind of sort of undermines the theoretical underpinning of those frameworks. So it's almost, it's a threat to the theory, it's a threat to the explanation, or at least that those as universal explanations for this phenomenon. Am I on track at all?
Oh yeah, yeah. It's a perfect question. Absolutely, this is exactly how the feminist, especially advocates, see that as as a threat to their main paradigm, the main framework they work in. And this is where I see the difference between real scientific theory, which we actually try to falsify, because only when it's falsified for the falsification principle, it's actually truly scientific theory. There should be conditions when it can be falsified, when it actually becomes an ideology, the idea that you shouldn't question even, because it's the truth and it's his truth, and you just do what you're told to do. So this is where I see a big difference when life scientific theory, very important instrument we use to explain the world, turns into an ossified set of ideas that shouldn't be challenged and become ideology. So that is why it's called paradigm or ideology sometimes. And I would say feminist theory is an important theory. It played a very important role in our attention to domestic violence, intimate partner violence. It's still very important for us to understand the differences in violence against women internationally, cross culturally. We see many differences in different societies, and gender equality is one of the serious factors that predicts violence against women. In societies where women do not enjoy equal rights with men, the violence against women are much, much higher, right? So we see that feminist theory, it can be a viable theory in a different context. When it comes to Western societies right now, it's in some ways, it's not, it doesn't explain many things anymore. For example, I told you, violence in lesbian relationship right now is one of the highest rates compared to heterosexual relationship and any other relationship in sexual minority groups. Why? We wouldn't we wouldn't think that that would be the case, right? So it's just an instrument. It's just a tool that, if it's not working, we develop other tools to that explains violence better. And we see that some sociological, psychological theories, it just explains it better. We
So
see there are many factors out there.
so like sort of tell me if I'm on the right track here, is that some of in sort of the social sciences broadly, we think about sort of, predictors of a phenomena, and that for any phenomena, pretty much, there's multiple predictors, and those predictors explain certain amounts of the variance, right? They explain certain amounts of the outcome. Why is this thing the way it is? Well, it's for a whole bunch of different reasons. So that a lot of the variables in feminist theory, that those are variables in the model, but they're not all of the predictors. So it's
Mhm.
not to say like none of these things are relevant, but it's that um, they are likely in certain, again, explain a certain amount of the variance in the
Yeah.
in violence, and it's going to vary across cultures,
Mhm.
across
Mhm.
cases.
Yeah, I agree. I mean, and we should use this valuable information for explaining certain variants in why violence happens, especially is in cross-cultural studies. This is what I'm finding right now. The major application of the feminist theory is in relation to the international context, especially to in the developing and non-industrialized countries. This is where we see that it works quite well, and it predicts those changes, right? Those higher rates of violence in the countries where women cannot even drive, cannot leave the house alone, and so on and so forth. So we see that, right? And it works. However, when it comes to the countries where there are men and women enjoying so much more equality, it's not perfect equality yet, but we're striving there, right? It's getting much better for women in the West, in Canada, the United States. It's getting better, and it looks like there are many more different factors that play an important role. Like I told you, one of the most significant predictors is experience in child abuse. That's a consistent and very strong predictor. Then verbal aggression in the couple. This is a strong predictor of physical violence. We know that if partners starting raising boys at each other, yeah, it's a strong predictor that it may lead, it may be associated with also higher physical violence. And there are some other factors like substance use. We know it um, due to various mechanisms affect chances of violence in relationship. People are just more likely to hurt each other when they under the influence of alcohol. We know frustration and stress affects people, right? We know level of education also plays an important role, and social status plays an important role. Like there are so many different factors, and I think by focusing on gender and inequality and dominance of men in the society, it's important in certain contexts. It's still important, and I'm thinking it's important in this kind of international context, in non-industrialized world, to look at that. But in our context, it we need to explore all other factors as well, because knowing them, we can actually deal with the situation much better if we know that this is what predicts very high chances of abuse later on in the spousal relationship, that this happens early in the childhood or during the growing up or in dating relationship. So we just much better equipped to address violence more effectively.
So, for folks who are listening to this and who want to learn more, who are more interested in your work or related work, are there any particular resources that you want me to point them to? So, things I would include in the show notes, that you think would be of value for folks who want to go further?
Yeah, so I think they can, if they're interested in my work, specifically in my publications on men's barriers to help seeking. We published a paper that decided quite well. We identified internal and external barriers for men to find help, and we provide citations, quotations of men who actually told their stories to us. So this paper and many other papers about the rates of violence, coping strategies of men, they all published on Google Scholar. There is under my name, and also yes, researchers net. I think researchers
Mhm.
portal. So there are papers, and I have some papers there in the full length papers. So it can be that people can actually read them if they want. Yeah, and if people can just contact me by email, and I will be happy to send a paper, papers, whatever they want.
Great. Well, Alexandra, I can't tell you how much I appreciate this. I've learned so much.
Thank you so much. Thank you so much for inviting me and to talking about this important issue. I really appreciate that.
Yeah, it's absolutely my pleasure. Thanks so much for watching. If you found it helpful, please like the video and subscribe to the channel. I'll see you in the next video where we continue exploring the science of psychotherapy and applied psychology.